Well, one of the concerns that comes to mind also is patients reporting their side effects to you.
That's true. I do see some patients do not tell me what exactly happened. However, the family member will come forward and tell me what's happening. So I will verify with the patient. I tell them it's not going to compromise your treatment. However, we want to treat your symptoms so that you can tolerate this treatment and we can finish the treatment successfully. So I really think it's not only the patient and also the family member support is very important.
How can you either minimize or treat these side effects?
The side effect to the esophagus, first thing is we have to educate the patient, let them know when they first initial presented with the symptom, we need to notify as soon as possible so we can control the symptoms as early as possible. The other thing is using an advanced radiation technologies. With IMRT and with a proton at this moment, we could spare the esophagus as much as possible, especially for a patient with treating with ipsilateral mediastinal adenopsis. Using proton may be more appropriate to spare the esophagus much better. However, if we are treating bilateral mediastinal adenopsis, then IMRT may be a better option.
Would you ever dose reduce on the radiation as a result of side effects?
We try not to, frankly, because if the goal for the treatment is curative, with a lower dose, the chances will be lower. So we try to achieve the higher dose we could give. We try to manage the symptoms instead of lower the dose because we're striving for the cure.
What are the sorts of things the patient can do on their own to help minimize some of the side effects, or just to be sure that they're doing the right thing, let's say for skincare?
So for the skincare, do not apply anything on the torso during the treatment unless instructed by the staff member. And do not put anything on the skin 4 hours before the radiation treatment.
Some of the remedies that patients like will be just aloe vera, fresh aloe vera. Even that, while it's likely safe, what you're saying is communicate with your doctor before you apply anything.
That's correct, because if you put any lotion or any cream on the skin before the radiation, actually you give a boost to the skin, which may cause more damage than benefit to the superficial areas, which cause progression of the disease, progression of the skin reactions.
And what about diet?
The diet is very important during the treatment. So the patient needs to drink plenty of water and increase calorie intake, and as well as increase protein intake. If they cannot take counter both increase, calorie intake is most important thing. I would encourage a patient eat anything if they could. Sugar, perfect fine. Chocolate, perfect fine. As long as they can eat and swallow those things. So calorie most important.
One other recommendation would be you don't have to eat 3 large meals. You can eat small meals and graze throughout the day.
Small but frequent meal will increase the calorie intake. And also patients found it's much easier to increase the calories and it's much easier to tolerate.
And what about the side effect of fatigue? Between chemotherapy and radiation, you know, once hemoglobin can go down, what do you advise for dealing with that overwhelming fatigue that can accompany treatment?
So fatigue is compounded by both chemo and the radiation during the treatment. So patients should continue their activities. I always inform the patient, do not because I'm receiving a chemo and the radiation, I have a reason to not do anything, stay in the couch. I told them, continue your hobby, do some exercise as much as you can tolerate. There's no restrictions of your activities. However, if you do feel tired, take a nap. However, get up and after you wake up, and there's no restriction. Enjoy the life.
Thank you very much, Haihong Cai, nurse practitioner and adult nurse practitioner from the MD Anderson Cancer Center at the Proton Therapy Center, for shedding some light on how we might manage some of the toxicities that accompany the treatment of non-small cell lung cancer.
Thank you, Selma.
Pleasure meeting you.